Hello everyone, this is James, the SADI-S guy. I want to do a video today. Hopefully this won't be too long, but I want to talk about sleep apnea and CPAP machine use after weight loss surgery. Back in October 27, 2014, I had the SIPS procedure, also called the SADI-S, loop duodenal switch. You can research all that. I'm not really talking about that procedure so much today as talking about beforehand, during the workup leading up to surgery. One of the things I had to do was go for a sleep study to see if I had sleep apnea. Well, I knew before going in there that I had sleep apnea. It was just undiagnosed. And if you have sleep apnea, you know you got it. I mean, it's one of those things where you'll snore, you'll wake yourself, you'll feel yourself wake up choking, night sweats, you just wake up tired. There's so many different signs and symptoms that go along with sleep apnea, and I had pretty much all of them. So I went for the sleep study because my doctor required it. And during the sleep study, they did confirm I had sleep apnea, and while I was there, they went ahead and hooked me up with a CPAP machine for what they call a titration study, which is basically they could change the pressure of the machine so that you get the most benefit, but not too much benefit, if that makes sense. You want enough pressure to keep your airway open and keep you breathing good, but you don't want so much that it causes other problems or, excess pressure. So my number was 12. That's 12 centimeters of water. That's what they had to set my CPAP machine at when I got it from the home health people. So when I started using it, I was really, blown away by how well this thing worked. I was sleeping better than I'd slept in years. I was waking up feeling energized. I had energy during the day, didn't feel like I needed to take a nap. It really was revolutionary in my own life. Fast forward several months after weight loss surgery, and here I have lost 100 pounds or so. I'm starting to get these. My CPAP machine will tell you if you've had to give you your AHI number, which is your apnea hypopnea index, which is a number based on how many sleep apnea episodes you had during the night or whatever. I'm not exactly sure on how they calculate that. All I know is mine is usually less than 1, which means basically none. But the CPAP machine will also tell you your mask fit, which is important, because if your mask doesn't fit right, then you're going to have some problems. So I would notice that mine would start going, tell me I'd have a bad night, mask fit wise, and then I'd have a good night, and then I'd have a bad night or two, and a good night or two. So it started kind of fluctuating, where I was not having good mask fit every night. So I thought, well, maybe my mask needs to be replaced. It's been about 6 months since I got the CPAP machine, and that's the interval where you can replace your mask. So I got a new mask, and it didn't really fix the problem. Through my research, what I found out is that the mask fit doesn't necessarily measure how much air comes out just around where the nasal pillows go in your nose, but it just determines how much air comes out in general. So between that and my wife telling me, look, you're starting to sleep with your mouth open, which when you got a CPAP on, when you sleep with your mouth open, this is about what comes out. That's what it sounds like. All the air is blowing out your mouth when you open your mouth. Well, and you're not getting the benefit of keeping your airway open. So I started waking up really tired and noticing I was tired in the afternoon, and even though my AHI number was good, my mask fit was bad. So I did a little more research, and basically what I found out is that when your mask fit doesn't fit right, or you're losing air by sleeping with your mouth open, your CPAP is worthless. You might as well take it off. Matter of fact, I would go without it some nights and I would sleep better. Reason being that all that air coming out of my mouth would wake me up, even though I didn't really pop up fully awake. It would wake me up enough that I couldn't get REM sleep. But I knew I still needed to use a CPAP because sometimes I'd wake up if I didn't have it on, I'd wake up feeling a little like I was choking, which told me that, you know, hey, you probably need to get your CPAP straight. So really what I needed to do was adjust the pressure, and really to find out what you needed, the pressure you need to go for a sleep study and let them do a titration on you. But that costs a couple $100. Since I've lost 1/3 of my body mass, I would assume that my CPAP number would go down from 12, which was fairly high, again, to something lower. And knowing that I'm hopefully going to lose at least 40 to 50 pounds more from where I am now, maybe more, and maybe even get cured of sleep apnea, I didn't want to spend the money to go get a sleep test right now, knowing that it's going to continue to change. So what I did was did some research and figured out how to change the pressure setting on the CPAP. It's kind of complicated, but it's if you do a little research online, you could change it. Now, I'm not recommending you do this. You know, you can figure out if your situation needs it, whether you want to go get the sleep test and have the home health people adjust it, or if you want to try it yourself. Again, for me, I want to do it myself just because I don't need to spend the $200 right now and then have to spend another $200 and some in a, you know, 6 months to a year once I'm down at goal weight. So I went ahead and adjusted it, and I adjusted it down from 12 to 8. And my thinking on why to go to 8 was because I've lost 1/3 of my body mass. Maybe I should go take off 1/3 of my CPAP pressure. Since doing that, it's been almost 2 weeks. I've had a good mask fit every night. I have slept so much better. I don't wake up tired and grouchy, not tired in the afternoon. So I think I've got it figured out. And my AHI number is still less than 1 usually, or if it is 1, it'd be like 1.4. But that'd be most nights it's less than 1. So I think I've pretty much solved my problem, at least for the time being. But I just want to put this out there. So if you're a weight loss surgery patient and you're kind of following along with me, if you notice that your mask doesn't start, you know, it's not fitting well, or if you start to wake up tired, you know, some of those old symptoms you had when you were, you know, undiagnosed with sleep apnea, check your pressure. Again, consider changing it yourself or going and get it, you know, a sleep study if you want to do that and change it that way. But I think it'll make a difference, especially for folks like us who are losing a lot of weight, and our everything seems to sort of change. You know, our clothes size changes. You know, how much food we can eat. Everything about our lives is changing. So our CPAP pressure, I mean, it would make sense that would kind of fall in line. Again, I'll go ahead and cut off at 8 minutes here and just say thanks for watching, thanks for following along. If you have any questions, as always, about my procedure that I had, or CPAP, or whatever, I'll be glad to answer them. Hope you guys have a great day.